Dr. Jennifer Savage. Today I have Aquriya Muller. She will be presenting on the marijuana pain management effects among NCAA athletes. Thank you for attending.
Good afternoon, everyone. So my name is Aquriya Muller, and I will be presenting on marijuana pain management effects among NCAA athletes. All right, disclaimer. This presentation is not intended to persuade you. This presentation is intended to inform you by utilizing research that supports this topic. All right, so let's start off with our clinical scenario. So we have Antonio, who is a 20-year-old NCAA Division I basketball player. He complained to his athletic trainer that he has been experiencing chronic muscle spasms. The athletic trainer created a rehab plan for him and gave him prescribed NSAIDs. Antonio complained to his athletic trainer a week later that he was still having significant pain after practice and during his games. The AT set up an appointment with the team physician, and Antonio expressed that within those 2 days, he started utilizing marijuana. He stated that it has been helping him manage his pain as well as improve his ability to sleep. All right, so for a show of hands, has anyone heard of marijuana, heard about the substance, as well as the substance controlling pain management?
Sure.
All right, so about a good amount of hands we have. So this substance is a plant that is known as cannabis, weed, herb, pot, Mary Jane, and a variety of other terminologies. As of June 26, 2024, the NCAA banned this substance from its drug list. As of December 2020, there was an estimated of 4.3 Americans to utilize marijuana medically. Utilizing this substance could improve pain management as well. It can be brewed into tea, consumed through foods, and smoked. And some similar foods or things that we see it in our brownies, cookies, and even our everyday foods. So what is our focus clinical question? So in NCAA athletes, does marijuana use compared to those who do not use marijuana improve pain management? So P for our population, we have NCAA athletes. I, our intervention, we have marijuana use for pain management. C, comparison, we have NCAA athletes who do not use marijuana. And O, outcome, improves pain management. Our databases. So the databases that were used throughout this research was 1, GemFinder, 2, PubMed, and 3, Google Scholar. Our keywords that were used were marijuana, cannabis, pain, NCAA, as well as athletes. There were 94 articles that were retrieved throughout those 3 databases, but only 4 articles were used to answer my direct clinical question. So what did we need in this research? So our inclusion criteria, we needed a study involving the NCAA athletes, research examining marijuana used for pain management, and of course we needed to be written in the English language. Our exclusion, we did not need studies focusing on non-athletic individuals, as well as research that does not address pain management. So here is our evidence quality assessment. So our 2 scales that were used were Strobe and JBI. The study types that were conceived were observational study, public opinion article, education news article, and quantitative research studies. And if you can look at the level of evidence, it is a level evidence 4. So remember that as we go out throughout the presentation. So what are our results in our summary? So marijuana can offer many benefits to injuries, such as improving oxygenation of tissues, improving concussion-related symptoms, reducing muscle spasms, enhancing concentration, and decreasing pain. Marijuana has also helped decrease pain, improve sleep, and relax patients with fibromyalgia. which is a condition that is still having research done as far as why those patients are experiencing those symptoms. The anti-inflammatory properties of marijuana have helped with post-exercise treatment. So for instance, when you have an athlete that has just finished competition, it basically is saying after they are done, as far as if they are having any inflammation, that will help with utilizing, it will help with utilizing this substance, with helping with that. So what are our strengths and weaknesses? So the strength is, this research was within the last decade, and of course we have some weaknesses. So the majority of this evidence was a lower level evidence, which, as we've seen, majority of all of the evidence was a level 4. So basically within the scale, it ranges from 1 to 5. 4 meaning that is a lower level of evidence, meaning that is less reliable as well for each particular study. The substance can also have a negative impact on behavior, performance, and competition. So what is our clinical bottom line? So marijuana can serve as a potential alternative for pain management. More research should be conducted due to inconsistent effectiveness amongst athletes. The substance can have an impact on behavior and performance. Athletic trainers and healthcare providers should stay involved about the evidence-based practice and policies. So how does this amplify to us as athletic trainers as well as athletic trainer students? So number one, staying up to date to the NCAA policies. As you guys remember, that policy is fairly new. It was June of 2024. Improving our evidence-based decision-making and clinical practice. Provides healthcare providers effective and alternative pain management strategies. Therapeutic interventions are still emerging, so broaden our mindset. Let's think outside of the box rather than keeping our mindset inside of that box. And as far as making our treatment plans for our athletes. Here are my references. I would like to say thank you for the JSC Student Symposium for allowing me to speak today. Thank you to my family and to my cohort for the opportunity that I have had to come to Alabama as a non-resident residency, as well as them supporting me throughout my grad program. Do I have any questions for today?
Well, I don't know if I'll ask one, I guess. You said something earlier, I guess sleep's probably just good for recovery in general. I think it was in your scenario where you said they
Yes.
need more sleep or something. So,
Yes.
I mean, is there some of the evidence facing towards that, like it just helps with the sleep, which helps with recovery, or?
Yes, so it
Is it
can
something
help with,
different?
yeah, so it can help with sleep. It treats everyone differently.
Okay.
And then you have how much of it are you consuming as well. So I didn't go into detail as far as number-wise, just because the amount of evidence that is found is still being researched into. It's very new, and that policy is very new. And as we all know, it is not legal in every state. As far as here, it is not legal. So, of course, evidence as well is going to be limited due to having people that can support the evidence. Say, for instance, if you go up to the Bay Area, you're going to have more people to be able to test this type of stuff on, just because it is legal up there.
Sure.
Any other questions?
Well, if not, another round of applause for.
Thank you.